physician and the president-elect of the National Physicians Alliance. The National Physicians Alliance represents over 20,000 doctors from all specialties across the United States. And we are 100% committed to fighting for guaranteed, high-quality, affordable health care for all. As the great Senator Ted Kennedy said, every American deserves to have decent, quality health care as a fundamental right and not just a privilege. It's up to every one of us here today to make sure that we transform his dream into reality. The legislation that Senator Kennedy championed and the bill put forth by his colleagues in the House of Representatives will make decent quality health care available to every American. It will give our patients the peace of mind that their health insurance will be there for them when they need it, no matter what. The legislation is simple. If you have insurance through your job, your coverage will be secure and your costs will go down. If you don't have health insurance, you will now have a choice of affordable plans, including the choice of a public health insurance plan. A public health insurance plan that will force private health insurance companies to compete on cost, quality, efficiency, and patient satisfaction, so we don't have stories like Stacy's anymore. It means that you can't be denied coverage for a pre-existing condition or dropped if you get sick. It means that you can't be discriminated against because you're a woman and might have a baby. Because you're a victim of domestic violence. Or because you made a typo on the form that you filled out when you were getting your health insurance. It means a cap on out-of-pocket expenses, tough new rules to cut waste and red tape, and a focus on preventing illness before it strikes. And most importantly, it means putting health care decisions where they belong, in the hands of you and your doctor. What does reform mean to me as a physician? It means it will be so much easier to take great care of my patients. It means that I can spend more time in the exam room and less time on the phone fighting with private health insurance companies. It means I can prescribe medications for my patients without worrying which ones they can afford. It means I will be able to spend more time preventing illness and not just treating it. Most importantly, it means that I can reassure my patients that no matter what, they will never have to worry about losing their health insurance or going broke paying for health care. At the National Physicians Alliance, we receive stories from our physician members every day. And many of these stories are about patients who have private health insurance. They are stories about medications that are not covered, chemotherapy delayed because of cost, insurance policies that are canceled when patients become sick. These are patients that have played by the rules all their lives. They have worked hard, they have paid their taxes, and when they finally need health care, they find out it isn't there. These are stories that should never have to be told in a country as great as the United States of America. We can fix this crisis right now. Under Senator Kennedy's bill in the Senate and the America's Affordable Health Choices Act in the House, stories like this would be a thing of the past. Affordable health insurance would be guaranteed for all Americans. Patients would never be denied care based on pre-existing conditions or dropped from coverage due to illness. Patients would pay little or nothing for preventive care. Medicare benefits would be improved, not reduced. That many of the reforms being debated are controversial for some. In fact, some have suggested that we start over from scratch. As a physician, I know know that my patients cannot wait any longer. I know that the need for reform is urgent, and so do my colleagues. Organizations representing over 500,000 doctors support health care reform and health insurance reform. And the National Physicians Alliance is proud to be one of those organizations. The next month will be critical in this effort. So when you leave here today, spread the truth about reform and let your coworkers and your neighbors know that doctors and patients agree. We need health care reform, we need it now, and we can't wait. Thank you.